Hi, my name is Fernanda Garcia Perez. I'm going to talk about acute varicocele revealing renal cancer. Definition. A varicocele is a dilatation of the pampiniform plexus of the spermatic cord, this network of the spermatic vein. Varicocele occurs more commonly on the left side because the spermatic vein opens at a sharp angle into the left renal vein, whereas the right spermatic vein opens into the large inferior vena cava. An acute non-traumatic varicocele, especially on the left side, may indicate the presence of a retroperitoneal mass.
Varicocele basically again in the males, that is the enlargement of veins located within the scrotum, especially on the left side and along the spermatic cord. So they appear like a tortuous worms located within the scrotum when anyone feel it. Varicocele, generally it is very common, about 15% in men between the 15 to 25 years age. The exact cause is not known, however, it is because of the incompetence of these valves which are helps in the unidirectional flow. Because of reflux of the blood from the abdomen into the scrotum, it is caused, just like the varicose veins of the leg. Varicoceles generally it may not be detected because it may be asymptomatic in few people and generally it presents. However, it produces dull aching pain and the enlargement of the scrotum in the involved site, and sometimes it may be painful with overexertion or any stressful activities.
Applications in medicine. A 65 years old man with no notable medical history present to the urologic clinic with swelling in the area of the left testicle that had started 4 weeks earlier. Examination of the scrotum revealed a mass in the right flank. Computer tomography of the abdomen and pelvis revealed multiple bilateral renal tumors, with the largest tumor located in the left kidney was performed. And the results confirmed the diagnosis of renal cell carcinoma. 1 weeks later, the varicocele disappeared.
Does the varicocele affect sperm quality, sperm count?
It does, and it's thought to have. And so this is very interesting. So if you go back in evolution and embryology, the reason the male testicles are outside of the body is because that's a temperature control thing through evolution. And it turns out that sperm don't really like the warm temperature inside the body. And when blood flows the wrong way and refluxes back into the testicle, it heats the testicle up. And just a tiny change in temperature can affect the sperm motility, the development of sperm, and the sperm count. And it's thought that this backward flow of blood that warms the testicle actually causes the sperm count and the sperm function to change.
So there was a graphic we just had up that was an ultrasound here. I want to put that up once again. Tell us what we're seeing here.
Okay, what we're looking at, this was an ultrasound of the testes, and this is right above the level of the testicle. And this is the same picture with both color and non-color flow. So the one on the left side of the screen is grayscale, and you're seeing what looks like a tortuous tubular structure, which is black. And then when they put the color imaging on it, you see blood going in all different directions, or you see reds and blues in greens, and that's just blood that's sort of slushing around and going one way and then the other way in these dilated veins. And this is exactly what a varicocele, this is a varicocele, and what we see and how we diagnose it.
With all of these vein issues going on here that we're talking about and blood flow issues, it would seem to me that it's likely that there's a connection here between varicoceles and heart disease. How am I doing?
Very well.
Actually, yeah, in reality, it's all part of the circulatory system, but the heart disease really affects more on the arterial side.
Okay.
And so this actually doesn't really come into cardiovascular disease that affects the heart. This is more in the peripheral, away from the heart type of problem. So patients that have varicoceles are not at higher risk to have heart disease or anything like that.
Pros and cons. Pros. It's associated with renal cancer. Is frequent that such a development should be regarded as sufficient cause for paleographic or other appropriate studies. Cons. Tumors causing varicocele tend to be large. Other retroperitoneal tumors and a variety of non-neoplastic conditions may be responsible for the development of varicocele later in life. Issue plated in Ecuador. Varicoceles most commonly present as unilateral dilatation of the papiniform plexus of veins above the left testis. Left-sided varicoceles are present in approximately 10% to 20% of men and are believed to be secondary to the venous anatomy of the left testis. Right-sided usually occur as a bilateral process and are apparent in 10% of clinical cases and in as many as 50% of subclinical cases.
So clinical tip of the day, if you have a patient who's varicocele, do not empty after you make them recumbent, that is, you make them lie down. That should raise strongly a suspicion of renal cell carcinoma. Especially this happens on the left side most often, and the reason is that the renal cell carcinoma obstructs the renal vein and the gonadal, left gonadal. Remember, left gonadal vein opens directly in the renal vein. Right gonadal vein opens in aorta. So the gonadal vein is obstructed. That causes the emptying of the left testicle difficult, and that causes the varicocele. The most sensitive and specific test for this, diagnostic test for this, is abdominal CT scan. Remember, the ultrasound of the testicle is going to do nothing. It is not a cancer of the testicle that would show up, and the ultrasound of the testicle is not going to show the issues going on up in the kidney.
Conclusion: acute kidney injury occurs as a result of a mass effect or as a result of thrombosis of renal vessels. But the cause of varicocele is usually the obstruction of the inferior vena cava and characterized by an acute onset. It is presented should perform a complete abdominal examination in every patient with varicocele or testicular pain, because the large tumor can cause abdominal pain as a late manifestation.
Well, with regards to renal cell carcinoma, I will share with you my perspective as a urologist. So what I see in my everyday practice are patients who come in generally with a diagnosis of renal cancer, having localized disease, although there are unfortunately patients who come in sometimes completely asymptomatic. And when they receive the first CT scan of the abdomen to see what's going on, and we find disease which is completely diffused, and the patient would be totally asymptomatic. So when starting from that position, the use of these drugs is important in two settings. When you take out a kidney or you remove partially a lesion from the kidney, and it comes out that the final pathology is very bad, with aggressive disease, perhaps unexpectedly one lymph node is positive. We know that the final prognosis for that patient is bad. And we would like to have results of studies suggesting that one drug, if administered, is going to improve the final prognosis of the patient. So this was not true until several months ago. There were studies done with different types of drugs, sunitinib specifically, that would suggest that perhaps there was a positive result, but studies were conflicting. Now,
Thank you.